Normal range of hemoglobin during pregnancy is 10 to 12 grams per deciliter, 8 to 10 grams per deciliter, 12 to 14 grams per deciliter, 14 to 16 grams per deciliter. The correct answer is option A, 10 to 12 grams per deciliter. Due to hemodilation, the hemoglobin level slightly falls during pregnancy. A minimum of 11 grams per deciliter is considered normal. Increased urinary frequency in early pregnancy is due to hormonal changes, pressure of uterus and bladder, increased blood sugar, kidney function. The correct answer is option B, pressure of uterus and bladder. The enlarged uterus presses on the urinary bladder, leading to frequent urination in early pregnancy. The normal presentation of fetus at term is breech, shoulder, cephalic face. The correct answer is option C, cephalic. In 96% of pregnancy, the baby's head cephalic is the presenting part, which is ideal for vaginal delivery. The most common cause of maternal mortality in India is sepsis, eclampsia, postpartum hemorrhage, obstructed labor. The correct answer is option C, postpartum hemorrhage. Excessive bleeding after delivery remains the leading cause of maternal death in developing countries like India. The period after delivery is called antenatal, postnatal, perinatal, natal. The correct answer is option B, postnatal. The postnatal period starts after delivery and lasts about 6 weeks, during which the mother's body returns to normal. Which vitamin prevents neural tube defects in fetus? Vitamin C, folic acid, vitamin D, vitamin B12. The correct answer is option B, option B, folic acid. Folic acid taken before and during early pregnancy prevent neural tube defects such as spinal bifida. The normal weight gain during pregnancy is 5 to 7 kg, 8 to 10 kg, 10 to 12 kg, 13 to 15 kg. The correct answer is option C, 10 to 12 kg. The average total weight gain during pregnancy is around 10 to 12 kilograms depending on pre-pregnancy weight. Which of the following is a danger sign in pregnancy? Nausea, mild leg swelling, severe headache, backache. The correct answer is option C, severe headache. Severe headaches, especially with visual changes or swelling, may indicate preeclampsia, a dangerous condition. The first milk produced after delivery is called foremilk, hindmilk, colostrum, mature milk. The correct answer is option C, colostrum. Colostrum is a thick yellow milk secreted in the first few days after birth, rich in antibodies and proteins. The most common site of fertilization failure, ectopic rupture. Ampulla, isthmus, fimbriae, cornea. The correct answer is the most common site of fertilization failure, ectopic rupture. Ampulla, isthmus, fimbriae, cornea. The correct answer is option A, ampulla. Ampulla region of the tube is where fertilization occurs and also commonest site for ectopic rupture. The softening of cervix during pregnancy is known as Chadwick sign, Goodell sign, Haga sign, MC Donald sign. The correct answer is option B, Goodell signs. Goodell signs indicate softening of the cervix observed in early pregnancy. The softening of lowering uterine segment is called Haga sign, Chadwick sign, Goodell sign, MC Donald sign. The correct answer is option A, Haga sign. Haga sign is a softening of lower uterine segment, a probable sign of pregnancy. The bluish discoloration of vagina during pregnancy, Hagar sign, Chadwick sign, Goodell sign, MC Donald sign. The correct answer is option B, Chadwick sign. Chadwick sign is due to increased vascularity causing bluish coloration of the vaginal mucosa. A woman who has never been pregnant is called primigravida, nulligravida, nullipara, primipara. The correct answer is option B. It refers to a woman who has never conceived. A woman who has not delivered a viable baby is called primigravida, nullipara, multipara, multigravida. The correct answer is option B, nullipara. Nullipara means a woman who has never given birth to a viable fetus. Fetal heart sounds can be heard by stethoscope after 12 weeks, 16 weeks, 20 weeks, 24 weeks. The correct answer is option C, 20 weeks. At 20 weeks, fetal heart sounds are audible by penile stethoscope around 20 weeks of gestation. The hormone responsible for uterine contractions during labor, oxytocin, estrogen, progesterone, relaxin. The correct answer is option A, oxytocin. Oxytocin released by posterior pituitary stimulate uterine contractions during labor. Relaxin hormone helps in strengthening the uterus, softening pelvic ligaments, milk excretion, fetal growth. The correct answer is option B, softening pelvic ligaments. Relaxin softens pelvic ligaments and cervix, facilitating childbirth. The hormone mainly secreted by corpus luteum, estrogen, progesterone, HCG, FSH. The correct answer is option B, progesterone. The corpus luteum secretes progesterone, which maintains the uterine lining for pregnancy. The part of fetus that enters the pelvis first is called attitude, presentation, lie position. The correct answer is option B, presentation. Presentation refers to the part of the fetus that lies over the pelvic inlet, example head and bridge. When the fetal head is well flexed, the presenting part is brow, vertex, face, phragma. The correct answer is option B, vertex. In vertex presentation, the head is fully flexed, making it the most favorable position for delivery. Engagement of the fetal head means descent of the head into vagina. The widest part of head enters pelvic brim, head rotation, delivery of head. The correct answer is option B. The widest part of head enters pelvic brim. Engagement occurs when the biparietal diameter of the head passes through the pelvic inlet. The hormone responsible for secondary sexual characteristics in female: estrogen, progesterone, FSH, LS. The correct answer is option A, estrogen. Estrogen promotes development of female secondary sexual characteristics like breast and wider hips. Normal menstrual cycle length is 21 to 25 days, 26 to 30 days, 28 days or 28 plus 2 days, 32 days. The correct answer is option C. The average menstrual cycle lasts about 28 days. Rough 26 to 30 days is also normal. The first menstrual period in girl is called menopause, menorrhagia, menarche, metorrhagia. The first menstrual period in a girl is called. The correct answer is option C, menarche. Menarche is the onset of menstruation in females, usually occurring between 10 to 14 years of age. The first menstrual period in a girl is called menopause, menorrhagia. The first menstrual period in a girl is called. Correct answer is option C, menarche. Menarche is the onset of menstruation in females, usually occurring between 10 to 14 years of life.